Well, hey, family, this is Pastor Jennifer, lead pastor here at Jackson Revival Center Church, and we are so elated that you have chosen to spend time with us today here in the break room. And I am so excited to have Miss Ella Garner Jackson with us today. She is a nurse of 43 years, recently retired, serves as president of Mississippi Congregational Network of Nurses and Advocates, and also is the leader of the Health and Wellness Ministry at New Horizon Church under the leadership of Bishop Ronnie Crudup. We are so excited to have you in the break room today.
Thank you. I'm just thrilled to be here.
Yes, ma'am.
I'm thrilled to be here.
Well, we are thrilled to have you here.
Thank you.
I'm someone who can speak firsthand what it is to have good people like you in the healthcare industry when our loved ones are sick. I know you were there when my dad was going through, and it was grateful to have someone that you could ask questions, someone who could keep you informed, let you know next steps. And so just grateful to have this opportunity to be with you today. Yes, ma'am. Well, you've got some interesting things going on, but before we get into that, tell us a little bit about yourself and what you're doing right now.
Okay. Well, now you said 43 years, so I won't tell you all of that 43
all right,
years.
All right.
But my nursing career started in 73, and I worked at the bedside. I was a nurse manager for 25 years at Baptist, pediatrics, and a little bit of peds ICU. And I did that for 25 years, loved it. We had a wonderful unit. The Lord allowed me to be involved in a lot of things.
Yes.
After 25 years, I felt like I needed a change, and the Lord evidently thought so too. He pushed me out in territory I wasn't familiar with. I at the end of that 25 years, I began another career still at Baptist, but I became a case manager.
Okay,
and that has propelled me for the rest of my life, I think, because case management is being at the bedside, as you talked about, with families when their loved ones are going through, finding resources for them inside the hospital, outside the hospital, making connections. Right. And I did that on oncology for 12 years. And then the last 5 or 6 years, I made a lateral move. Okay. And I went to just general all over the hospital. But the last 3 years, I was on cardiac, and I really enjoyed that. So I have taken care of kids from newborns all the way to 101 years old. I think was the oldest one. Yeah. And I've done that all of my career, even on the pediatric unit. We had some adults.
Well, I'm sure you've seen a lot of changes in healthcare over that period of time.
Tremendous changes. Some good, some not so good. But changes nevertheless.
Absolutely. Yes. I was having a conversation with a friend the other day, and I said, it used to seem like in the healthcare industry, doctors were there to get you well. Now it seems like healthcare overall has changed to kind of treating symptoms and just medicating and some of those kinds of things. But lots of changes. Lots of that has to do with the insurance industry.
Absolutely.
And so many different things. Well, I saw some information not long back about a program that was being offered. And so you're here today to kind of talk about that. This goes back to what you said about connecting people to resources. And I have really, over the last few years, seen the power of connecting people to resources and how easily lives can be saved. If people simply have access to the right information. The Bible says, my people perish for a lack of knowledge. And I've literally seen that play out where people have passed away, been ill because they didn't know where they needed to go or who to contact or what needed to be. So you're here today and we want to talk about this information. And so it has to do with getting mammograms for those who may not have insurance, talking about breast cancer. And so I guess we'll just kind of start there. What is breast cancer?
Well, but before we get started there, we're going to talk, we're going to, at the end of this, we will have empowered moms.
All right.
And dads, but particularly moms. This is May and it's Mother's. Mother's Day is in there and everybody's focused on mom. And so we're going to remind moms of their roles, because they wear many hats.
Absolutely.
And certainly one of those is advocacy. So beginning with breast cancer.
Yes.
You asked what was breast cancer. Well, the breast cancer occurs when you've got renegade cells. You know, the body is set up so that cells generate, they live, they die. And then when you get these renegade cells, new cells just start coming sooner than they should. Yeah. And then they break off, and then they form tumors, and there we go with cancer. We've got this overgrowth of abnormal cells, and you've got cancer. And that's cancer regardless of where it is. That's what cancer is. Now, breast cancer. We have men that have breast cancer. But 98% of the cases for breast cancer is women. Right. But men do have breast cancer, so we're not going to leave them out. Right. Now, talking about breast cancer, let's talk about a mom making sure that when she's talking to her daughters and her grandchildren, because grandchildren love their grandmamas and their mamas, because, you know, we're a safe haven sometimes in between the mamas and the dads. Right. And sometimes they'll listen to us more. And so we would encourage, one of the things that you need to know to prevent breast cancer is to know your body. Right. So you want to encourage young people, and then we need to be role models for everybody, for children, ourselves, and for everybody. Yes, ma'am. So we need to know our bodies. Some of the signs of breast cancer that you would look for is to look at your breast. You need to know your breast. Know that it's not just right here, but it starts here, and you need to become familiar with it. Feel it. Are there any lumps? That's the first. That's the one that everybody knows. I got a lump in my breast. Right. But even before that, sometimes there is dimpling, or it may become distorted. One breast look different than the other breast, or change from the way it used to look. There may be a rash. It may have pain or swelling, all of those things. But you may not pay attention to that if you don't already know your breast. So the recommendation is that, once a month, you choose when you're going to do it. Look at your breast, and then just lay down. And I love YouTube. You go on YouTube, go to CDC, any of the breast, cancer.gov, ask for a video of how to do a breast self-exam. Right. There you go. Okay. And then do it, and make a commitment to do it once a month. Then we as grandparents or mamas can say, did you do your breast exam this month? Did you look at how everything's looking? So that's the first step, know your body. And then the clinical breast exam. So those are done usually when you go to a healthcare provider. Right. And you need to start having those done once you start going to a healthcare provider. Right. And then the mammograms. Now, that's the basic screening tool for finding breast cancer and lumps in the breast, diseases of the breast. But I just talked about the doctor doing an exam and you doing an exam. The mammogram is going to pick up things that you won't feel. Right. And then you've gone to health fairs where you see they've got these little tiny ones. The mammograms picked up this, but you didn't feel it. Right. You have the little models. And so that is why it is so important to get your mammograms when you need to start getting mammograms. Right. And typically, what is the age that people begin receiving that? 40 has been and still is the beginning age. But 35 is becoming... Most insurance will start paying for it at 35. And I need to just say 35. Yeah. Because that's where you ought to have that first conversation with your doctor. Talk about your family history and talk about what your insurance will pay for. Now, the one thing when I talk to the breast and cervical cancer people, the program that they have at the Mississippi State Department of Health, the nurse there, blanked on her name, but she said the main thing that you need to walk away with is tell women that if they don't have resources to get a mammogram, regardless of their age, you need to call us. Yes. Because there are funds, and we may have funds that we can reallocate to take care of you if you have a problem.
Right.
So that's the number one thing. But mammograms, that's where you start. So make sure you start getting your mammogram. Now, if you have a family history of mammograms, a mammogram of breast cancer, you may want to start getting a mammogram even before 35. What they say is that if your mom was diagnosed with breast cancer, you need to start getting your your mammograms at that age or a little bit earlier.
Okay.
So for those women, you can still call, and I'll just go ahead because we're going to use this number several times.
Okay.
It's 1-800-721-7222. And that's how you can access the Mississippi State Department of Health Breast and Cervical Cancer Program. So that's a way that even if you are not 35, not 40, feel like you have a strong family history, feel like you're having something going on, call them.
Right.
The other program that we have that we've been blessed with because LaFleur's Bluff Links, the organization, has given one of our organizations a grant to provide screenings for those women that may be younger than the recommended age, or they may just not have insurance or may have an issue going on, or the breast and cervical cancer program may not have funds for it.
Right.
So that is still a safety net, net for people to get to.
Yes. Yeah. We had someone in our church who was having some issues and did not have insurance, and they came to me for prayer because they were concerned, but I was able to pray, but I was also able to reach out to our health and wellness congregational health nurse, and we were able to connect that young lady to resources. And she did have an issue going on, but thank God, because of the resources available, she was able to begin receiving care and was not just left out there for breast cancer to continue to progress.
That's a blessing.
And so from that point on, we started doing something annually, to make sure we're presenting it to people, to allow people to understand there are resources. Even if you don't have insurance, you can get the health care that you need. So Ms. Jackson, tell us, we kind of talked about some of the non-preventable risk factors as far as it running in your family, and a few of the preventable risk factors as far as self-examination, doing that monthly self-check. What are some other things that people can do to make sure they're staying on top of breast health?
We've got this pamphlet, and our moms are going to have this because they're going to go to the website and download it and have it there as a tool. We like weapons. This is going to be one of our weapons. Okay. Eat right. Exercise.
So when you
maintain a healthy body weight, eat green leafy vegetables, grains, healthy foods. Fiber, stuff that's going to fill you up and come on through, clean you out. Leaf green vegetables, the grains, fruits. Not very little meat. As little meat as you can, and when you eat it, don't fry it. Yeah, and choose the lean portions of meat when you're going to eat something. And don't overeat. We will get the 12-ounce steak. Right. Cut it down. And then trim the fat away. And then don't do it so often. And then exercise. Those are the same things that we say about heart disease and diabetes. We've learned that they're good for cancer too. Cancer prevention too.
Yeah, I've often heard it said that cancer feeds off of sugar, and so not having a high sugar diet.
I don't know if CDC says that or not, but that'll preach anyway.
Yeah. All right. So, how does someone determine if they have breast cancer? So we talked a little bit about the mammogram. What else?
Now, you're not going to know it because unless some of those warning signs I tell you, and that is what is dangerous about it. And that's why it's so important to get a mammogram and do your breast self-exams because you can have a tumor that in your breast, especially if you have dense breasts, you know, you're not going to feel it.
Right.
And it will be there growing and have grown somewhere else if you haven't had a mammogram. And so you don't know unless you see something or feel something that's abnormal.
Right.
But don't wait till you get there.
Right.
Get the mammogram.
Right.
Get the mammogram. Strong history, start at 35. If you don't have if you have insurance, your insurance should pay for it, and they should pay for it without a copay for mammograms at the age that they provide them. They should pay for it without you having copays for that. If you have, now I'm glad that we're talking about that. One of the best things about this program, this breast and cervical cancer program, is if you find, and I've had 2 women I've walked with, one with breast cancer, her mom had a history of breast cancer, and she had felt like she wanted a mammogram, and at that time, some years back, she had approached the provider about having a mammogram, and they'd say, you know, check with the insurance. Insurance didn't cover it. She let it go, you know. Wow. And then when I met her, she had felt a lump in her breast. She had insurance. But you know, the cost of cancer, medication and treatment is astronomical.
Absolutely.
If you are a single parent, or you can be a dual household parent, and you are the working poor, or you know you work as hard as everybody, or more harder, but you work at 30 hours a week, 38 hours a week, just right under the 40, so you don't get the benefits.
Right.
And then you've got a lump in your breast. But you got, you know, you need to be seen. And and if you have the insurance, the point I was making about if you have that insurance, you've got 4 kids, you got 3 kids, you've got 2 kids, but you make less than $42,000 a year. And I just looked that up because, and it's on the website. Then you're at the 250% of the poverty level. And therefore, if you seek treatment through this breast and cervical cancer program and meet the criteria for Medicaid, if you're diagnosed under this program, then you get Medicaid that will pick up those other 20%. Yes. Now, that's just not for everybody. You've got to do it under this program. Right. And that is why when people come to us, we as the congregational health nurses, your health ministry people, those others that I work with, we say, before you allow somebody to put a needle into that growth, find out whether or not you qualify for the breast and cervical cancer program. And get connected with them. You need to call them, because in order to be connected with them, you have to be cared for by one of the clinics. You know, in Jackson, it's the Jackson Hines Comprehensive Jackson Medical Model. Some of those federally funded clinics. Right. You have to be with one of those clinics. And then the breast and cervical cancer people make the application for Medicaid. So it's a process, but it's a beneficial process. Absolutely. What this young lady found out, it says she had state insurance, but it was like in December, she was going to start a treatment in January, and you know you have that out of pocket. Right. And that was astronomical. And she had to have the screening. She had to have the lump. Well, she had to do it. She had to have all the X-rays. She had to have a port put in because they had. And so her out of pocket would have been, and some physician office and hospitals ask for that money up front. Right. Okay. Right. And so you're talking about a lifesaver. You think about the fact that you're raising children, you're working, you're diagnosed with cancer, and then you got to worry about the income too. So, you know, that burden being lifted can help you focus on what you ought to focus on, yourself, your children. Right. And in the era of COVID, that was pretty hard with kids, and you're trying to make sure they stay in front of the computer. They're not outside playing ball.
Right.
When they,
Right. Absolutely.
when they're supposed to be in front of the computer.
Yeah.
So this program has been a lifesaver. And I hope that I have represented it well and that our audience is understanding what I say.
Yes,
but you don't have to rely on me. It's on the web. It's on the Mississippi State Department of Health website.
Okay.
And then there's this number that you can call, 1-800-721-7222.
Okay.
So that's to access both the breast and the cervical cancer program, but we were just talking about the breast cancer.
Very good. So if there's some young lady or older lady watching now who has found a lump in their breast, they are able to go ahead and look into this program, especially if they meet the criteria we've discussed as far as income, and know that there is help available.
Right, absolutely.
Yes.
Income mainly because, like I said, Nurse Jamie said, don't let anybody feel like they don't qualify.
Right.
Because the pamphlet doesn't speak to them directly to make the phone call.
Right. And so we're going to make the information from this pamphlet available for you so that you will have the information needed if you want to reach out to see about this program. Something else we wanted to talk about is cervical cancer.
Yes.
So can you tell us a little bit about cervical cancer and the risk factors for cervical cancer?
I'm going to pick up this same little folder, this little brochure. I just love it. It's going to do everything we need to do.
Okay.
Cervical cancer, we talked about what cancer is. It's those renegade cells that they just proliferate, just multiply when they shouldn't be multiplying. They don't wait for the other cells to die. They just multiply.
Right.
Split off, cause cancer in the cervix.
Right.
Now, the cervix is the opening to the womb. It's where we carry our babies. There's the vagina, there's the cervix, and then there's the uterus. Cervical, that's what cervical cancer is. That's what cervical cancer is.
Okay. And so is cervical cancer preventable?
Yes.
Okay.
I love to say this. I love to say this.
Yes.
Because there's so many things that are not preventable.
Right.
Yeah.
Right.
And this is an aside, but when I worked in pediatrics, I saw every year there were certain things that you knew the kids were going to come through with. And you knew that you were going to have some poor outcomes. Right. And flu or Haemophilus influenza, or the hip disease, was taking kids out with meningitis. I knew every year a mama was going to be left childless because of that. And I remember praying, Lord, please, Jesus, don't let somebody else have to go through this. Yeah. We prayed. I remember praying. I know there's a lot of mamas and other people praying. Absolutely. And then we heard they're going to do a vaccine. There's a vaccine that's coming forth. It's going to be, they're doing the trials. It's going to be available soon. Yeah. So then it came out. We could give it to kids that were 2 years old. And because that's what the research had been done on. So we didn't see kids dying at that age. I remember specifically having a child that I think was like 6 months at the time, but he wasn't old enough that the vaccine had been tested on. That child died. And I thought, oh Lord, Jesus, we have got to make this available for everybody. Well, now everybody get it. They get the hip vaccine as routine part. And it doesn't have to be those poor outcomes. Right. What a blessing that is. Yes. That's a vaccine. Yeah. Yeah. I love vaccines. And I love vaccines. And so when you ask me, can we prevent cervical cancer? Yes. And we need to make sure that we as moms and parents are doing what we can do to prevent cervical cancer in our kids. Right. There's a vaccine. Human papilloma vaccine. Right. And it is given to kids.
HPV for short.
That's right. Thank you. That's right. HPV for short. And that virus causes 90% of the viruses that leads to cervical cancer. And what we know now is that it's been around for about 12. Well, the vaccines came out about 12 years, but they have data from 10 years that has shown that teenagers, and they did it on girls, teenagers, the drop in the number of teenagers with HPV with the virus had dropped did I say 80%?
Wow.
80%.
That is huge.
80%. Those are the teenagers. 40% for adults. And probably the lower end of that is because they got the vaccine after they'd been exposed.
Right.
And so that is why it's so important for us to give it to our boys and our girls at age 11 to 12.
Okay.
And they'll get 2 vaccines within a year. Now, if you wait until your child is 15, then you're going to get 3 vaccines within a 6-month period.
Okay.
And then up until age 26, you can still get the vaccine. Okay. After that, you've probably been exposed, and your risk for having the best outcome has decreased.
Okay.
Has decreased. And that's why it's so important that we love our children. We raise our kids right. But we use what the Lord has provided. Because every good and perfect gift comes from Him.
Yes, it does.
And so He gives us the tools to save lives.
Absolutely.
That was His ministry.
Yeah.
That's what He did.
Yeah.
And so we're not going to talk about why the virus, how the kid get the virus, or whether my child is going to get the virus. We're going to prevent. We're going to prevent a poor outcome.
Absolutely.
We're going to have your child healthy so that we don't have to get treated for cervical cancer or for precancerous lesions in the cervix, so that they can carry us healthy grandchildren.
That's right. So does health insurance usually cover the cost of testing and treatment for cervical cancer?
Let's talk about the vaccine first.
Okay.
That most in Medicaid pays for it. Most insurance pay for the vaccine because they'd rather,
because it's prevention.
Yeah, it's prevention.
It's much cheaper to prevent it than it is doing chemo and surgery and all things like that.
Absolutely.
Right.
But if you don't have insurance, the State Department of Health has a vaccine program. Vaccine for Children. VFC is what I read. Vaccine for Children program. And you can get your vaccines for there if you are uninsured or you don't have the resources to pay for the vaccine. There's no reason why we don't have access. And there's a lot of things that we don't have access to.
And let's talk about health disparities, because some people don't understand why these health disparities exist. So let's speak to that a little bit.
Oh, Lord. All you have to do is to know a little bit about our history.
That's right.
Yeah, a little bit about our history.
So there's medical mistrust.
There's medical mistrust. There's poverty.
Right.
It's just blatant poverty.
And poverty should not keep anyone from receiving proper health care.
Right. They should not. But then poverty go all the way back to stress and stressors.
Absolutely.
And how we're raised in our families. What our parents are working hard, working 2 jobs, still not making ends meet.
Right.
And then they go to the store to buy something and somebody's following them all around in the store like they don't have, stressors, poverty, racism.
Right.
Those are all where you live.
Right.
If you live in some of our neighborhoods, the trucks with the big engines can come blowing down your street.
That's right.
All of those pollutants coming out. Your child's got cancer. And not cancer, has asthma.
Right.
And there they are in the hospital. And people are wondering, why can't you keep your child well? Well, that's where I live. That's where I can afford to live.
Right.
All of us. So where you live, where you work, where you eat and play. All of those kinds of things.
Determine what you have access to.
Right, absolutely.
And some of our people living out in the country, places like that, if they don't have clinics as close by, if they don't have transportation, that impedes their ability to access health care. So many things, again, going back to poverty, if you don't have money to put gas in your car to travel to Jackson from one of these neighboring counties or different areas, all these things add to the reason that there are health disparities.
Absolutely.
Especially among African Americans.
Yes.
So I like to paint the picture when we're doing these interviews because everybody doesn't always understand. And so I'm trying to connect dots for people.
You're connecting. You're doing a great job.
So that people will understand and have compassion.
Compassion.
And understand why it's important to have programs available and to put this kind of information out.
Right.
Yeah,
and not vote down things that's going to help a vast number of people.
That's right.
Just because it's not going to help you.
That's right.
Or because...
but actually, that's one of the other dots I like to connect. Helping other people helps everybody. When everybody gets access to healthcare, when everybody has access to education, it just makes our community better as a whole.
Much better, right.
When one prospers, we all prosper. When one hurts, we all hurt.
Right.
And when people understand that, I feel like there won't be as much, back and forth. That we've got to understand we are all connected. We are our brother's keeper.
We are our brother's keeper.
Our skin color doesn't make us our brother's keeper.
That's right.
Being men and women of God, being children of God, makes us responsible for one another.
Absolutely.
And so that's important to me for people to understand that.
Right. And sometimes the Sanhedrin Council is not Jesus.
Right. You're right about it. You're right about it. Yeah.
I'm just saying. And so, true Christianity, having empathy and compassion on the least of them.
That's right.
Makes,
because Jesus said, when you've done it unto the least of them, you've done it unto me.
Preach, sister.
Yeah. So,
yes,
absolutely. So, very, very important.
I'm glad you mentioned when I was a case manager for oncology, a lot of people stepped up to the plate, and I think the Cancer Society did this. Had people that were coming in for treatment, they gave them vouchers for gas.
Yeah.
And I know that when one of our organizations is part MCNNA, Mississippi Congregational Network of Nurses and Advocates, have always supported the walk and the march, and we've given money, and we particularly wanted it to go for transportation. Right. I also I'm a consultant for a board in the Delta Alliance for Congregational Health. It's a board of pastors and community people around health and wellness in the Delta. So I see firsthand, and then I'm in the hospital as a case manager, and I see firsthand, why did you miss your radiation treatment? Well, my neighbor was going to bring me, but my neighbor charged me $30, and I don't have the $30, so I couldn't come. And you're thinking, I know the neighbor needs gas and has to have maintenance on their car, and so maybe I can't blame the neighbor. Maybe we need to help create a system, and so Medicaid expansion. Why can't we do that? Right. Because they will provide transportation too. They have
absolutely.
So
I think some people don't understand what Medicaid is for and how many needs it truly does meet. Because there are a lot of people who wouldn't even be living now.
I can tell
if
you
it
that.
were not for Medicaid.
I can tell you
and
that.
I have seen firsthand the importance of having Medicaid in place.
Absolutely.
It's got to be there. It's got to be there.
It's got to be there. It's got to be there.
And I you hear all the time the rich get richer and the poor get poorer. Well, there's a reason for that. And you have to understand that at the point you have more than most of the people around you, you've got a responsibility.
Absolutely.
To do good with what you've been given.
What you've got.
Yeah, absolutely.
Much is given, much is required.
That's
absolutely.
Right. That's
absolutely.
right. So, well, I appreciate you so much for coming to give information about this program. I know so many lives have been lost to breast cancer, to cervical cancer. I personally have buried friends with both. And it's not a good feeling, especially when they're in the prime of their life or they're young. You don't have to be old to get breast cancer.
You don't.
You don't have to be old to get cervical cancer.
Right.
And it's heartbreaking to see the things people go through sometimes,
Absolutely.
Especially when it can be prevented.
Right, absolutely.
And early detection certainly is the key if somebody has it.
Absolutely.
So thank you so much. And we're going to make this information available for all of you to know how to access this program. Do you have any closing thoughts for us?
Just do not allow lack of resources to keep you from getting a mammogram, a pap smear, or the vaccine for your children.
Absolutely. Absolutely. Knowledge is power. The Bible says, my people perish for a lack of knowledge. We want you to have the information you need to access healthcare, to access information, education, whatever is needed. We want to provide it. So I want to thank everybody for taking the time to join us today. If you know a friend, a neighbor, a sister, a church member who needs this information, tag them in this post. Share this with your friends. Share it with your family. And look, if you're being blessed, we're asking you to join us back next week, same time, same place. Until then, my sincere prayer is that God's absolute best would be yours in every area of your life. And you already know, I want you to go and make today a great day.